The science of cognitive behavioral therapy, how it helps with mental health issues. Cognitive behavioral therapy, or CBT, is a type of therapy that is based on the cognitive model of psychopathology. This model states that our emotions and behaviors are based on our thoughts and beliefs. CBT is an effective treatment for many mental health issues, such as anxiety, depression, eating disorders, substance abuse, and more. CBT has been shown to be more effective than other types of therapy, such as psychoanalysis, in multiple studies. CBT is a shorter-term therapy, which means it is less expensive and less time-consuming. It is also a more practical and problem-focused approach. If you are struggling with a mental health issue, CBT may be a good option for you. What is cognitive behavior therapy? Cognitive behavior therapy is a type of psychotherapy that helps patients identify, understand and change patterns of negative thinking and behavior. CBT is a time-limited treatment that focuses on present problems, unlike psychoanalysis which explores the past. Cognitive behavioral therapy also involves the teaching of specific cognitive skills to help patients monitor and change their dysfunctional thoughts, feelings and behaviors. CBT is often used as an adjunct to medical treatments such as antidepressant medications or counseling. CBT can be applied to the treatment for many mental health conditions including depression, anxiety disorders, schizophrenia, eating disorders and personality disorders. Research has shown that cognitive behavioral therapy not only helps people feel better more quickly than antidepressants alone but also produce more sustained benefits over time. Evidence-based CBT treatment for depression. People diagnosed with major depressive disorder, MDD, are about twice as likely to experience a recurrent episode as those who have never had the disorder. In fact, MDD is the leading cause of disability in developed countries in part because of the high rate of recurrence. Depression can be caused by many different factors, including genetic predisposition and life events. However, cognitive behavioral therapy, CBT, has been shown to help people manage their depression symptoms and reduce the chances that they will experience another episode. A comparison between cognitive behavior therapy, medication, and placebo for treating depression. Cognitive behavioral therapy is one type of psychotherapy that helps people find new ways to cope and respond to the negative thoughts and feelings. The idea behind cognitive behavioral therapy is that the thoughts we have and the way we react to them can affect how we feel, think, behave, and interact in our lives. However, there are other treatments for mental health issues such as medication or placebos. Both can be effective for treating depression, but they work differently than cognitive behavioral therapy does. For example, antidepressant medications alter chemical balances in the brain, whereas cognitive behavioral therapy changes how you think about a situation so that you have more control over your moods. How cognitive behavioral therapy helps with mental health issue. Cognitive behavioral therapy, CBT, is a type of psychotherapy that seeks to challenge thoughts and behaviors in order to more effectively manage mental health conditions. CBT has been shown to be effective for a number of conditions, including depression, generalized anxiety disorder, obsessive-compulsive disorder, post-traumatic stress disorder, PTSD, eating disorders, and social phobia. This is accomplished by helping clients gain insight into the thoughts or behaviors that contribute to their distress and providing tools they can use to change these thinking patterns or behaviors. CBT has also been shown as an effective treatment for suicidal ideation and behavior. One study found that 85% of people who had made at least 3 suicide attempts before therapy were still alive 5 years later.